So the ovarian hyperstimulation syndrome is one of the potential life-threatening, actually, complications with IVF. And I have to say, in the last few years, because of the protocols that we're using and the strategies that we have put in place, the risk of OHSS is extremely low. In fact, the risk of having severe or critical OHSS is probably less than 1%. However, sometimes things are coming, these things can go wrong in a way, and the patients can be sick. And there are two types of OHSS. One is the early onset. The early OHSS is sometimes linked to the final injection, the trigger shot, and that usually develops within 72 hours from the trigger shot. And if that develops, then really it is mandatory to freeze the embryos. So if a patient is already ill the day or 2 days after the egg collection, then really we must freeze the embryos. We shouldn't really transfer them, because if we transfer the embryos, then there is a high risk of developing a late onset of OHSS, which is the one related to the embryo implantation and the production of the pregnancy hormone called beta-HCG. Now, the pregnancy hormones will then stimulate the ovaries again, and that is when it becomes a little bit of a catch then, because you can't stop the pregnancy, but is the pregnancy making your ovarian hyperstimulation worse? So, that is when the severe or critical cases sometimes take place. And it is important, obviously, if you are experiencing any symptoms or signs of ovarian hyperstimulation at any point during the treatment cycle or after the embryo transfer, that you get in touch as soon as possible with your doctor, your clinics, or with the emergency services if it is out of hours, because the hyperstimulation is pretty serious, and really the risk should be kept to the minimum.